Trauma can be defined as any event or experience that's highly distressing or potentially life-threatening for an individual. Following a traumatic experience, our bodies go into fight or flight response mode. And this is a protective measure that our bodies employ in order to help us survive that trauma. So there is going to be a period of adjustment and increased symptoms following any traumatic experience. We call this period acute stress disorder. If those symptoms persist for more than a month or so, then it transitions into what's known as post-traumatic stress disorder. What people have to understand is that sometimes symptoms don't manifest for up to 6 months or even more following the experience of any traumatic event. So it's really important to just be patient with yourself or a loved one following any sort of traumatic experience, and just know that it's very treatable. There's lots of help and lots of support that we can provide. So it's important following the experience of any traumatic event that you're really paying attention to your symptoms. There's going to be a period where you're not functioning at baseline. That's normal, it's natural, it's your body adjusting to that traumatic experience. But if those symptoms are severe or they persist for longer than a month or so, it's time to seek treatment. All of our programming is trauma-informed, so we're able to address any symptoms of trauma along with any co-occurring mental health condition for all of our clients. We have some specialized trauma-specific programs in some of our outpatient facilities for veterans or first responders, for example. So these programs are very tailored specifically to that population and to those types of traumatic experiences. But with individual group therapy, medication management, and all of the services that we offer in our outpatient programs, we're able to very effectively help people who have experienced trauma.